The Cambridge Oncometrix research team, based at a dedicated laboratory in Norwich, has discovered chemical element biomarkers that may indicate the likelihood of prostate cancer. They use X-ray fluorescent spectrometry to measure these novel biomarkers in sperm. This approach is supported by an SBRI contract for developing a centralised laboratory service for the NHS.
Our test is simple. It is robust biomarkers, which are chemical elements produced by prostate, which we have patented. We are running now the clinical trial across the UK with multiple clinical centres, with key opinion leaders, with the help of SBRI contract. It will bring numerous benefits to patients, clinicians and NHS. Patients can repeat the test as many times as they wish without any harm to their health. Clinicians will have additional tool for informed decision before sending patients to biopsy, and NHS potentially can save a lot of money.
Hello, my name's Rebecca and I'm a TXRF technician for Cambridge Oncometrix, and I'd like to explain to you how our measurement process works. It all starts off with our sample kit sent to our patients. It contains a pot and leak-proof packaging so that they can send it to us from their homes. Once we receive it, it will be processed very quickly in about 30 minutes in a way that it deposits the sample onto this carrier so that it can be placed on our trays. The trays can then be placed within our machine. Our machine is very high throughput and can measure up to 90 samples in one go. In my experience, the software is very simple to use, and this machinery requires very little training. We're currently using this technology for our clinical trial in prostate cancer. However, we understand that it would be very useful to be used in a variety of different medical applications, and we would love to see this technology used in other establishments.
We recently entered a long-term collaboration agreement with the major scientific instrument manufacturers with the goal to transform their analytical instrument into diagnostic one. One of the tasks assigned to us is to develop a diagnostic module, a prototype of which I'm holding in my hand, into diagnostic instrument which would read analytical data and transform it into a diagnostic score that we safely transmit to a doctor for clinical decision. During our clinical trial, we test the performance of our small box and prepared for regulatory approvals to bring our technology closer to the market and to the patients.